Okay, so good morning, everyone. This is Veronica Bolchik, and it is Friday, October 31st at 9:07 a.m. Happy Halloween to everyone. And this is the Contract Review Committee, and I'm the chair. And the first thing I'm going to do is establish quorum. So, um, um, this meeting is being conducted in a hybrid fashion because we have people up on Zoom and we have some folks in the trailer. So with a roll call first for quorum, I'll do committee first. So I see Lee Tesser.
Here.
And Suzanne Keating.
Here.
And Joanna Roach.
Here.
And John Balash.
Here.
And myself, Veronica Bolchik. We have a quorum. We're expecting Linda to join us in person in the trailer shortly, so we'll note when she comes in. On the town administration side, I see Jericho Maley, and I believe you're remote.
I am.
Okay, and Alexandra Richards in the trailer holding down the fort and administering the Zoom.
Here.
Okay, and we do have one member of the public, Tara Risteri. She's on Council for Human Services, and she's joining us today as a member of the public. And what I'm doing is I'm fumbling, looking for the agenda. So the next thing I believe is establishing, or at least accepting the agenda. So if I can have a motion to approve the agenda.
So moved.
Second.
Second.
Okay, Lee second. So by roll call, Lee,
Aye.
Suzanne,
Aye.
Joanna,
Aye.
John,
Aye.
and myself. So we have an agenda. Public comment. Tara, would you like to say anything? Okay.
No.
All right. Thank you. And I don't think we see anyone else from the public there. I'm gonna rely on you, Lexi, to let us know if anyone comes into the Zoom that I'm not aware of. So we don't have minutes for this. So our next item is approval of Sharing Kindness and Fair Winds quarterlies. At last meeting, we approved the rest of the quarterlies, but these were two that we had some questions on. So yesterday, Lexi sent us a email with the information that we had requested. So first on Sharing Kindness, they gave us some detail. Does anyone have any comment or because otherwise we can hold that and we can probably vote for both at the same time. So I was satisfied with the information that they provided, and they are a new organization, so you know, getting used to our reporting system, et cetera. So I was satisfied. So Suzanne, is that your hand up?
No, I was scratching my head.
Oh,
I was
okay.
just trying to remember what I read last night and I'm going, okay. I was just gonna make the screen smaller and look at it.
Right. Basically, they won't be starting their group up until November, but it's the administrative things, et cetera, that they did during the quarter. So I was pleased with the information they provided. Next, a little bit more complex is Fairwinds. So Joanna, to bring you up to speed on this, Fairwinds, the question was for their, it was actually the opioid grant that was awarded to them. And, the grant was for peer recovery coaches for Q1 as it was presented to us. And that's what we were expecting, but the quarterly basically with great detail on patient contact information, just with dates and, billing, but it was for roughly a quarter of the amount of the grant. And it wasn't for the entire, which that's what we're expecting. So we asked for clarification, and what they provided is it was sort of a mea culpa, we need to use the money during the entire year as opposed to just the quarter. That for myself, put up a flag, because that's not what, I went back and I read the grant and what we had awarded them, and that wasn't the intention. And Joanna, I don't know if you want to add in, or John, because you two have a little bit more of history, and I know that, I'm trying to be just in just looking at this grant and what they're asking, but unfortunately, there's somewhat of a pattern, and I don't want to say that, but there's some history with, where they're reporting and the understanding, et cetera. So I'd like to hear from some others what they feel before.
Veronica, can I
Yes.
just ask a question?
Yes.
Which is, this is a question really for Jericho. This is outside of the, this is outside of the reporting. Yeah.
In the there's
Oh my, Jericho,
no-
Jericho, you are at the Revolution Hotel.
you picked that up from just that?
Yes.
It is a fantastic little hotel. I really
I
like
know.
this place.
That's so funny. All right, sorry.
No worries. So there is no restriction on the grant is, good for the full fiscal year, but it is notably different from the request. And we weren't, it was just sort of done. Generally, if you're going to completely change the schedule and tempo of a program from the grant, you would at least want to tell us first, I guess.
Yes.
So, and it's not quite what using it to facilitate uninsured or support uninsured people is, I think, slightly different from what they asked for, which was more administrative and structural support.
Yeah.
So I'm not sure exactly how this would work given this information. And I'm not sure that I can sort of endorse this alteration without speaking to finance in a little more depth. I apologize, but I've been out of office and I have been otherwise engaged for this week, so I haven't had a chance to run down any of the details. And unfortunately, I am going to be largely out of office next week, so it may be a little bit before I can really dig into what the restrictions, etc., are on this. But
all right, so in grant world, if you have a grant and you want to use it for something different other than what it was awarded, you need to ask for permission.
Yes.
So
it's also just sort of good practices, especially if you're going to be changing it from what you were planning on spending it on in the agreement. So that's sort of,
So since I wasn't here last time, did anybody come and speak to this? Did Roberto come?
No.
No, we had the quarterlies and we reviewed them, and that was a red flag. So we asked for information, and that came through. Lexi sent it to us yesterday, I believe.
I
And
saw that.
they basically are, and it's always, do they have a legitimate reason for asking for the extension to make it a year, that's fine. But it's sort of like a microscopic view on what has happened. We can see
It's
because
also, yeah, it's every issue that we have been discussing, right? Which is
Exactly.
they need operational support. And these are programs that have been created to get the operational support that are
Exactly.
unable to be fully executed.
Right.
So, how much was I didn't see the reimbursement form.
It's basically a quarter, so it was $35,000, the entire award, and it was for 9,600, I believe, and change, something like that. But it's, you know, what
So this is going to continue through the year.
exactly. So they want to be able to use that. And, you know, the other thing, and I don't want to sound suspicious, but you know, it's hard to put what we know from the past, trying to just look at this, but you know, when you award $25,000 and it has $35,000, and what it is for patient contacts when the first quarter, and she gave, you know, very detailed, and it comes up to almost a quarter of what they're asking, and we got 3 more quarters. So, you know, it's sort of like, I don't want to get into micromanaging and saying we need to know, you know, more detail, but it's you know, we awarded the money for a specific purpose, and the appropriate thing, not over the appropriate, the procedure would be to come to us before and say, I know you gave us 35. We said we're going to use it in the first quarter for peer recovery, for the increased summer volume, etc. You know, it's not working out that way. Can we extend it over the year? We probably would have said, you know, yes to that. But here it is, it's after the fact, and there was no explanation in the quarterly. So if we hadn't asked, they would have continued.
I have just done this for a grant for us, had to go and say, hey, we were not able to use it in the way. Can we do X? So I think that we need to ask them to come to a meeting and
Mhm.
send something in writing and explain what's happening, and also to ask them to address it over the year period, not just the quarter, right? So that we understand what's going on.
Yeah. Yeah.
Just want to mention, John has his hand up.
Yes, John?
Well, does this affect our discussion? Because as I read the explanation, was that they had expected a grant to fund what they had asked for, which they didn't get, which obviously they should have let us know. But at least this is not saying we just didn't do what we didn't do what we wanted to do because we didn't get the money to support what we wanted to do. I don't know whether that changes our way we think about it, but at least it is part of the explanation.
And to follow up on John there is a lot of oddity in the grant environment right now. It is understandable that this would change, but this isn't contract review money. This isn't the human services budget money. This isn't the substance misuse budget. This is from the opioid remediation settlement, and we have a due diligence that we must do to ensure that it's being spent in the way that it was agreed upon when we received it. So
Right.
we actually we need, and to be clear, this looks to be exactly like what the opioid remediate, like this doesn't look like it's a bad use, but we need to know a little bit beforehand to figure out if it's an acceptable use on our end. So, you know, on my end, it's not as much the change, you know, and an operational grant with town tax base allocated money, this would be no problem. They would just let us know and be like, oh, okay, that's good. But this is slightly different from the other funding sources. It's also we just need a heads up, I think, primarily.
And, you know, but even though it is not human services or the substance misuse, we were charged with, as this committee, in selecting and administering the grant, so it does not make a difference. And, you know, we have, and I guess I look at a number of organizations we've worked with over the years, and we've made some suggestions because some of Fairwinds is a much larger organization, but we've had conversation with them, but with some of the other organizations where we've made some suggestions over the years that you need to improve, whether it's bookkeeping or administration or whatever. And I see some incredible results with some organizations they've shored up from suggestions we've made as sort of an oversight committee. We've made these suggestions to Fairwinds, and this is more of the same. So I think it's appropriate to ask Roberto or Roberto and whomever he'd like to bring in, but I would like to have some conversation before we approve or figure out what we're going to do here, because and I don't know if we can make a motion to have that happen, and I see Linda has joined us. So we have Linda Williams with us also. So
I got a hard stop at 11, so.
Okay, perfect. All right, so
So are we talking about the quarterly still?
yes, and we're talking about Fairwinds.
Yeah.
So can we, any more discussion on this? Because what I'd like to do, if we could have a motion that we approve sharing kindness, and we don't approve the Fairwinds until we have at our next meeting, if possible, which will be next Friday, ask Roberto and maybe a representative, whoever he'd like to bring, to come and speak to us. And
Well, I think we have to ask for a letter. We have to have some sort of in writing request to reappropriate the funds, right? Like, yes, he has to come and talk to us, but he has to put a request in writing and say why, right? More than that little thing he sent Lexi.
It could be that he explains the reason for the change, and then the planned uses of the money, and then the planned reimbursement schedule, if there is one. And then we would, when we're talking to him, follow up on that and see where it leads. But yeah, we do need sort of a written request to determine what we should be expecting from these grant requests going forward.
I mean, the reality is that he's using this money to subsidize payroll, guys. I mean, that's what's happening here, right? So whether he needs to just be transparent about this and say, I lost funding from X source. This money is going to underwrite payroll in peer recovery, so that because if it's anything other than that, we can't let him use the money. Right, and he needs to understand that, Fairwinds needs to understand that this money is designated for addiction issues, right, and recovery. And so he can't use this in any other part of his organization, right? There's not any way for us to really know that. But he needs to know that that is true.
That is true of any grant, because the CPC, same problem, what they apply for and what they've given the funding for, they can't change, period. It has to be only for the things that they applied for in the grant, because otherwise we're gonna get into trouble with the DOR,
Right.
et cetera, et cetera. So
Yep.
I agree with you.
Right. So just to sort of wrap this up, do we ask him to come in, and does he brings with us in writing their intention?
He needs to give us that in advance of the meeting, and he needs to
Okay.
come to the meeting prepared to discuss this.
Okay. All right, Jericho, can you send a written request to him with this detail? And
And I will speak to him about this as well. So just to try and figure out what's going on, and sort of get us on a nice steady tempo, as it were, on these. But yeah, we would need to get some plan on how they intend to use the funding, and a little more detail on the nature of the cause of why it changed, just more specificity, which, that's shouldn't be too difficult. And then I think it would be good if he came in and discussed it, or if whoever is the most familiar with it, is there with him.
Well, I would like him to come as their current executive director and bring whomever can help support him, but I think we've been down this route a few times, and sometimes it hasn't been, it's been very sticky. But I'd like to sort of like face to face, this is what we are looking for and this is what we expect. And so, yes, I'd like him to be there also. All right, so can I have a motion to approve Sharing Kindness and
Old,
all right, and so we can do it, we'll do it separately. So
So
second
moved.
for, okay.
So I move to approve the Sharing Kindness quarterly report for the first quarter.
I'll second.
As submitted.
Okay,
I'll second.
and the second, so by roll call, Joanna,
Aye.
Linda,
Aye.
Lee,
Aye.
Suzanne,
Aye.
John,
Aye.
myself. Okay, so now a second motion regarding
Okay.
Fairwinds. So
So-
I'll
Joanna,
make to hold Fairwinds for further information.
So can we make a motion to ask Fairwinds to submit a letter explaining the issue around their grant or quarterly grant report, and to detail any funding that they have lost, and to provide that to us before our next meeting, and to come and discuss it with us.
So I'll amend my motion to say that.
Thanks, Linda.
okay. All right, so Joanna first, Linda, you'll second that then?
I'll
She knows,
second.
she made the motion, I'll
Okay.
second.
Made the motion,
Okay, so
Joanna.
Joanna second, okay. So by roll call, Linda? Yes.
Aye.
Joanna,
Aye.
Lee,
Aye.
Suzanne,
Aye.
John,
Aye.
and myself. So we've got that put to bed for right now. So thank you very much for that discussion on that motion. And we now shall move on to our next item, which is reviewing the program grants. And at last week's meeting, we made some assignments for people to basically present, the grants to our group. And what I'd like to do is I've sort of numbered these, and I'm going from the bottom up. So we'll look at Warming Place first. And Joanna, if you can give us a overview of the Warming Place requests.
Sure, the Warming Place is asking for $75,000. And basically it is to continue with they basically describe it as continuing with greater efficiency and expanded services. So they are having 2 pilot programs this year, and they want to pay for behavioral health specialists to spend time at the shelter to help facilitate referrals. I mean, this seems to make sense to me. Their application was decent. You can see the growth in, unfortunately, the growth in the total individuals served. But this is a lot of money for not a lot of people, right? That doesn't mean that this is not important, but in the scheme of dollars that we are spending per person, right? It is it's a high number for a low number of people served.
Can't find the program on. I'll try to send it to you. But just send me that.
Just the program.
Yeah, just both of these on the same email, say the same thing.
Okay. All right. Any other comments on the
Well,
warming
what-
place?
So warming place, the comments that I really have is that, one, to make sure that they are working with all of the places, right? Because they are an organization that I think, needs to be very collaborative. And then I guess this is just more of a comment that I don't, they also are saying that this is gonna be used to pay the salary of the shelter manager, right? And
Right.
They're both operational, but one does say program, but they're both the same
Yeah.
attack. Weird.
so it says two different things, right? It says
Right.
in the first part of it that it is going to be used to expand the program, and then in the back side of it, it says it's going to be used to pay the salary of the manager. So
Right.
I think that this would be someone I would want to bring in and talk to about this,
Mhm.
frankly.
Yeah.
And also, for me personally, I don't exactly understand how it has worked for them to split off from the Interfaith Council.
It's the ACK Carzina.
Well, they split off because, well, they joined because they did not have their not-for-profit status.
Right.
And when they received their not-for-profit status, they separated and now they function under their own
This one.
501c. And that's why, so it was last year that we split the money and they went off on their own.
Very nice.
That's,
It's thinking.
I don't know if we need any more explanation, but yes, I think we should have Deb Dubois.
Yeah, but
Man.
is the Interfaith Council giving them money? That is my question.
No, not
No.
to my knowledge now. At the end of last fiscal year, no, 2 fiscal years ago, when they made a joint, when they applied under the Interfaith Council, they received 501c3 status at the end of that, and I believe for 1 full fiscal year, there's been no financial relationship between Warming Place and Interfaith Council.
Okay.
Because last year the application came directly from them. So it's been, I think that was 2024 that they split. So it's been some.
Right, because their profit and loss is very basic, and basically, grants receivable is $75,000, which is the exact amount they're asking for us. So that would also tell me that they're not doing any other fundraising.
Oh, they are doing fundraising. I know that's one of the efforts that they have going, but I don't know how successful. And they had received a gift that basically is what they have in their coffers that has started this organization. And so you can see that's where they have that money, and I know that they need to raise funds because they don't want to deplete that. That is what will keep them some
Sure.
sustainability.
Sure, but then this profit and loss is not effective enough for us to make decisions about whether or not to give them money.
Okay, so we should develop some questions out of this to give to them before they arrive.
Yeah, like what is their fundraising plan?
Mhm.
I think, can you send it in PDF? I'm having a hard time navigating it completely.
Right, so they should give us their fundraising plan. And also, like, if you look at this profit and loss, there's no salary line.
Right,
Right.
and they
Yeah.
have been advertising. I don't know if they've hired yet, but they have been advertising for a manager. And they also, last year, I think the award we gave them was to hire a manager. So they used last year's grant for
Well,
you
then
know,
their profit and loss should look much different than this.
differently. Yeah. Yeah. So let's see, we have some questions from that we will present to them. All right.
You said Lexi?
Pardon me?
Did you call me?
Yes, I said if you've got down the questions that we will ask them.
I did not get the questions. I'm trying to send the packet to Linda. If you could repeat it, I'll write it down quickly.
Okay. Joanna?
So we need to have a fundraising plan. And then we need to see a better financial statement, because this one doesn't even have staffing on here at all.
Okay,
And like, actually, this looks a little bit more like a balance sheet than it does a profit and loss. And what we need to see is the profit and loss statement, so we understand what their categories are.
Have a profit and loss.
Right, because I see that they have cash and savings and they have investments, but there's no fundraising lines here. There's no salary lines here. This is called, someone put a headline of profit and loss on a balance sheet.
Mhm.
okay,
Okay, and we will ask them to come in on the 14th, I think is when we're doing that. Alright. Any other comments on the warming place?
No.
All right. So with none, we'll go on to the next, which I'm basically going up the list. So the next is VNA, and that is me. So VNA has self-identified under healthcare, which I believe that's the appropriate way for this grant to fall. They are new to us applying for funds from Human Services. However, they have received funding from the Department of Health and Human Services for a number of years, I assume. And so this is just new that they are applying under this pot of money and administered by us. They provide definite, needed services on the island, from home safety evaluations to medical review and education. They assist with telehealth appointments for patients who can't navigate. They do home oxygen education. They assist patients with setting up Lifeline. They help setting up transportation. They do vital sign checks, and they help communicate with providers and community partners. So all that plus they do vaccines, and they communicable disease surveillance. And I think the one that jumps out here, beside the just the support for our general population, is the maternal health program that they do. And, it's the prenatal home visits, the postnatal home visits, the lactation groups they do. Then they have an Ask a Nurse clinic, just for that they do with the Family Resource Center. And then they also do a perinatal loss support group that they're partnering with Sharing Kindness, which is interesting. And that is provided for every birth on the island. So it's a vital service. And their application, they gave plenty of information here. It didn't necessarily follow our format, but the information is here. And I don't know how much we have funded them through the other town channels over the years, but they're asking for $75,000. And a question I did have is how many patients, patient contacts, or how many unique patients they are seeing in this area. But I'm not questioning the services they're providing, because I think that they're vital. It's just when we look at, $75,000, how many, it's sort of, we just had that conversation with the warming place, where it's a lot of money for a small group. I have a feeling that they see many more numbers than that, but I couldn't find that in the application, unless someone, it popped out that I couldn't find that. So that would be a question I would want to have from them. Okay, Jericho?
When I can speak to a couple of points about the existing relationship between VNA and the town. They were funded under a line item, a budgetary line item. We were primarily trying to ensure there's a gap around child and maternal health, especially around pre-birth and post-birth education. And then there was some homebound medical services that we were delivering through them. And then they had a public health role. I believe the contract has ranged from between 10 and 15,000. And those were, it varied from year to year, but and program to program, but it was in the order of 30 to 40 people under the very limited stuff that we were paying for. So this program probably has a broader reach than that. The reason why I think they are coming here now is because we were funding this line item through a couple of different grants, which are no longer available. We had the Rural Health Equity Grant, which we were using to help backstop their vaccination efforts, some vaccination and some public health efforts. And then we had a combination of budgetary funding and then parts of some funding from a collaborative organization that we're in with Martha's Vineyard's health departments. Those funding sources are more restrictive right now, which means that we either cannot expand or may even have to contract our contract with them. So I think this is sort of the reason that they are looking to get additional funding elsewhere.
Can you tell us approximately how much funding they've been receiving, say, in this past year?
Between 10 and 15 over the last 3 years. I think it's 10 this year, 15 last, and then it was basically steady state 10 for since I started.
Okay, so, and I had a feeling that's in that range, so when I see they're asking for 75,000, you know, it's a big jump. It's a big jump. But I also have to assume, but maybe we shouldn't assume, we need them to explain to us that they, like many other organizations, are maybe feeling some crunch with losing funding in other areas and looking for us to fill in that difference. Joanne, I see your hand up.
Yep, I just have a couple of comments about this one. One is their financials are not complete,
Yeah.
right? Like that, this is like, there's no way I would vote on giving this people any money without looking at their financials, because
Right.
what they do business in a lot of different areas, and we need to really understand how those other areas support them so we can establish like what is a good baseline for us to support them. And they're a large agency. And so again, what other types of fundraising are they doing? What other types of grants are they applying for? And then the other thing is I look at their trustees and I don't recognize any of those names as Nantucket. And I always have a concern for us giving money to organizations that have no local representation.
That's a good point.
Yeah.
Yeah. Yeah. And they've been serving on the island for years, correct? Jericho, I see your hand.
And I can speak to a couple of the points. They're working on the island a lot. I believe they've been here at least since MGB and probably longer than that. On island, they have several nurses, and then their head of operations is Kelsey Gray. And she's been there and in place for a few years in that position. And then I largely for administrative or other processes, we are working with someone who is the regional supervisor, I think is the term. And I think that oversees both Martha's Vineyard, Nantucket, and the Lower Cape.
But
Yeah.
one would think that they could at least have one person on their board of trustees who's from Nantucket.
Agreed.
Because it is Cape Cod Healthcare Foundation that, and I assume it would be Cape Cod and the islands, but if they're serving Martha's Vineyard and here.
But we've run into this problem before.
Yes,
Friends.
yes, yes. Oh, yes. Oh, yes.
And it's not good if they don't have anybody from Nantucket on their board. It's not good for us.
Okay. Alrighty. Okay, I see Suzanne and then Lee.
I think it's a very vital program. I've recently met a few traveling nurses that take care of some of these things. And I think that the services are vital to the people that they serve.
Mhm.
And so in some way, I would like to see a way to work with them on get their, financial stuff. And I don't know how we're going to get a trustee from Nantucket, but maybe we'll put that out there.
Well, it would be their charge to find someone, but, explain to them the importance of having local representation, on that level.
Yeah.
Yeah. Lee?
I was just gonna ask, Veronica, to your point, how does the committee look at the loss of funding generally? I mean, we all know what the current political climate is with federal funds, and at least one of my applications makes a big point of saying we're losing funding from source number one, source number two, source number three. Do we have a general idea of how we would evaluate something like that?
I'll start, but I'll ask other people to comment too. We've in this past, actually this year, have had some discussions on this, and, we have some organizations that, they've dealt with clawback, so where they thought they were getting funded, they've spent and they're not getting reimbursement on federal level. We've talked about trying to get some emergency monies. There are, just on Nantucket, we are government, we're on a government cycle, and we know that it moves a little bit slower than the private sector, but we have the Community Foundation on Nantucket. They are not government organization, and they, in this past year, have added more money into their grant and being able to help some of these organizations quickly with some. But I think it needs to be a factor in our deliberations of, as I think we all agree, what these folks are doing, they bring a vital service to the island, and we would not want them to go away. But, can we, we have a limited amount of money for this year. Can we afford to give them their full ask? And I think we're going to be faced with most of the organizations, because we have almost not double, but, what was it? This is 650,000, and I think it's was it 1.2? Jericho, can't hear you. You're muted.
I think 1.2 is the ask.
Yeah, so,
In that range.
we're gonna, it's gonna be a tough deliberations, because it's not that what they're doing isn't vital, but, give us more information, come in, let us talk to you, and then we'll take it all into consideration.
Okay.
Yeah. Any other comments on that? All right. So with no other comments on the VNA, we'll then go to STAR. So Linda, can you talk about the STAR?
I love this program. They're actually one of the only groups that's asking for less money this year. We gave them 30 last year. They're asking for 23 this year. And all I can say is that these guys are doing an awful lot with the little money that they have. They would like to increase their staff so they can increase their participation. Because to give you an example, FY24, they had 27 participants, FY25, 53 participants, FY26, 65 participants. They anticipate 82 participants. And this is a very specialized group. They have to be certified that they have some sort of a physical or mental issue, specialized need. And they're trying to expand and work with other organizations like the cycling center, the pool. They want to increase the gymnastics. They do a lot. And my first contact with them was when they were doing down at the beach, the Jetties Beach in the summer. They'd take the kids out on paddle boards and sailing and stuff like that. And it's a tremendous program. It is just caught on over the last 3 or 4 years. So there's not much more to say about it, except that if they increase their staffing, they only have 2 part-time year-round employees. If they increase their staffing, they can accommodate those 82 people and work with the AAN and the community pool and the gymnastics programs and stuff like that. So I think they're getting a lot of bang for the buck, especially when they reduced it by $7,000. I think they're being very judicious about what they're spending money on. There's not much more to say about it than that.
Mhm.
I
They've got a-
I was
they
very, I was very impressed with meeting Eliza and just the amount of programs that they do, and particularly their respite program that they do once a month, and the Boys and Girls Club has given them a room, and just for some parents and caregivers, the ability to even to go home and work on a project for a couple of hours, or to go out to have dinner, or to go do shopping, or to socialize without having to worry about what's happening with the care. So they do an awful lot, and I was actually, the first time we funded them was last year, and I was actually surprised that that they did come with only $23,000. It's unusual for an organization, and maybe it's just the approach. If we've got that, next year let's try to get more. So I think they're not asking for the moon and the stars. Jericho?
And just on the town side, they're sort of one of the archetypal volunteer driven, local community-based organizations. They work really well with other organizations. They're always offering us different programming that we fund that's all on the same theme, but they're coming to us for almost a specific ask for a specific thing. We've seen them have an extensive sort of referral relationship with other organizations. This particular grant looks to be, what the original intent of the CRC was for programming very much like this. And then, they're always excellent on the reporting process. They're always excellent on the application process. No, very, very solid organization to work with. And they gauge their requests specifically on what the need is, and do an excellent job with that.
What they did say is that if they didn't get full funding, though this is one of the smaller asks, is that they would still run everything, but they wouldn't be able to accommodate the 82 people that they're projecting. Because you have to have a certain amount of caregivers for
Yeah.
a certain amount of people. And so if we do this at the full amount, they should be able to get up to that 82 number. And they also invite, it's a very volunteer, but they also invite peers of the individuals that are in the group, whether it's a parent, a friend, or a sibling. So they probably one of the best run smaller organizations I've seen all these years.
I agree 100% with everything Linda said. These people are doing an amazing job with very little money.
Do we want to have them come in for an interview, or
I
I
don't think so.
right.
I mean, this one is like one of the few you read in the packet. It's like a no-brainer.
Right. But, of course, if they want to come in and speak to us, they're certainly welcome, but we won't require an interview from them, because I don't think we really have any questions that hasn't been covered. So, all right. So thank you, Linda. And
I have to say, they did a fantastic job answering the questions.
Yeah.
Mhm.
yeah. All right, going on to the next is Small Friends asking for 60,000 to bridge the tuition gap, and that's Lee. You tell us about this. Lee, you're muted.
Sorry about that, folks.
Okay, good.
it's an application to subsidize childcare for their teachers who are teaching at this preschool. I presume that's what it is.
Mhm.
I thought the application was a bit thin on the financials as compared to my other one, a safe place, which I thought was very extensive. I don't have as much of a track record as you all on this, so I thought the financials were a bit light. It certainly seems like a good cause as I read what they're doing is they're basically saying, look, we need to subsidize childcare for our teachers in order for this organization to continue and be viable. We have a one empty classroom. We'd like to fill the classroom. There's a need. We'd like to hire another teacher, but without the subsidy, it's difficult to do that, on Nantucket for reasons that we're all aware of. They're asking for $60,000, and they have 15 full-time employees. What I don't know is what their actual costs are for what the reimbursements are. I personally would like to see, okay, so what does it cost you to subsidize or reimburse your staff for childcare? I'd like to see some numbers on that. They're basically also saying that if we can't do this, and it would appear that they're getting money from other sources, but they're basically saying if we can't subsidize our current teachers, then we're gonna have difficulty maintaining staff. Again, probably a problem that we're seeing perhaps across the board. So I think it certainly seems like a good cause. The application was not as well developed as my other one, so I'll just kind of leave it at that.
Yeah, and just some history with this. We have funded them for as long as I've been involved, but it's been a very specific thing. It was for their summer program, etc. It was much less money. During COVID, as most of our organizations, they closed, when they opened back up, they have a hard time getting staff because, they run an excellent program. It's a wonderful school, but it's not public school. Their staff are fabulous. They're not paid a lot of money. It's childcare. I can go on and on and on. There's a whole lot of stuff wrong with how childcare is administered in our country, but we're not fixing that right now. But the fact that they've come now and asking for tuition to fill the gap, because childcare is right up there with lack of housing, food insecurity, or whatever. There's been a number, I think there's 2 facilities that closed this past year. Not as large as Small Friends, but it's not growing. It's shrinking, and the need is out there. So I think you're right. We don't have for the ask. They did not give us enough of a financial background on this, so I think we need to get a little bit more from them and then have them come in. Jericho, I see your hand up.
And I was just going to add on, this is a bit more ambitious of a program request from them than we've gotten in the past. It is a thing that they have been working against for the staff retention specifically, is a thing that they have been working against. It's been an identified need. And this specific approach is appealing to me because it seems like it's getting you're getting 2 birds with 1 stone. You're actually subsidizing childcare, in a way that allows more people to use it. And that's been identified as a significant issue, basically across the board, more or less, and more specifically on Nantucket. But then you're also at the same time making it easier for them and making them a more attractive employer. So you kind of get a 2-for-1 deal there. And then just a tiny bit of background from the start of from when I started, basically from summer of 2021, this has been something that they've been trying to address in a variety of different ways, the staff retention piece. And so I was quite interested to see this approach, which I think is kind of interesting and gives a couple of different bang for the buck elements to it. But yeah, I would like a little more detail on the cost outlay and sort of where, and this is almost as much from the HHS interest, sort of like where they see their staffing going on and where they see challenges are, because I believe there's a project a potential upcoming project with the town for trying to determine like a pretty detailed assessment of our current and necessary childcare, that I think talking to them about it might be informative to me in addition to the committee.
Exactly. And, as we all know, we are in the throes right now of our needs assessment. And, I'm anxious to get some data back on that. And I think that one of the areas is going to be childcare, because it's a major problem for our workers. Particularly during the season when we have workers that are stretched to their limit, the children need to be taken care of. So we will ask them to come in and give more detail on finance and just give us an overview of more information here. Joanna, I see your hand up.
Yeah, I agree with Lee. I think the finances are people. I don't understand. I thought it was really clear that these people needed to provide us with more than just this, right?
Yeah.
Like they need to give us an income statement, right? Or a statement of activities or whatever it is that we want to call it, that shows something other than what we're showing here. But the other thing that I just wanted to say is that in the last year, also Boys and Girls Club came on with their preschool. So for the first time, Small Friends actually has some competition, right? And that there's another place for kids to go to that is heavily subsidized. So I wonder what kind of impact that has on their enrollment, and also on their staffing.
I'm wondering, is that the same hourly, like Small Friends is like a day-long program? Is the Boys and Girls Club program part day or full day?
No, I think it's the whole day.
Okay.
I just want to I just want to know more about it so that we
Yeah.
can be informed.
Yeah. And I know that, we're not discussing boys and girls, but I know it started and there were very few children when we looked
Right.
at it a year ago, but I don't know what their current enrollment, but I think we can get more information from Small Friends when they come in and speak to us.
Right.
Right. Okay. All right. With no other questions, we'll go on to the Memory Cafe with John at Sherburne Commons. So,
All right, well, I'm up.
yeah.
I know, I think maybe I think in general, it is kind of an interesting application in the sense that we have very complete information about the residences themselves, which are the Sherburne Commons organization, which is sponsoring this program. And we have pretty good detail about the number of people served, which is, I believe, it was 40 in fiscal 35 in fiscal year 25, 40 proposed in 26. But so one of the things I think that interestingly enough, with a great deal of detail of what their programming is, proposed programming is and what it is. What you don't get out of this application is a true understanding of what actually goes on in a session. So they say, well, we have music, we have but I would really like a description of what a typical program would be for the period of time that the people are attending it, because I think that would be much more informative for our purposes, because almost every other organization, we have a pretty clear idea of exactly what they're doing. And here we have their program, but we don't actually know what's in the program. And that to me is the biggest lack in this application. I think my only other observation on this one is that compared to a lot of a number of the other organizations, what should I say? This is highly desirable, but if we have to scale it on the scale of what is absolutely necessary, this is kind of down nearer the bottom end of what is really necessary if we compare it to some of the things like a safe place or Meals on Wheels, or in terms of basic human needs.
Yeah, we've funded the Memory Cafe for a number of programs, and they've gone through a metamorphosis.
That's true.
The initial Memory Cafe was to be held for the individuals being cared for and their home setting and their caregiver. And it was dual purpose to give an activity to provide appropriate activity stimulation for the patient, and I'll use patient, maybe a client, I'll use client rather than patient. And then also an opportunity for some respite and exchange with caregivers. And in their first year that, this was, a number of years in trying to get it off the ground, in the first year, their numbers were very small. They would have one or two people show up, and we talked with them about, advertising, and they've taken direction from us over the years of, advertising. But then in this past maybe year, 2 years, they've morphed it into providing the services at our island home, at, I think, Landmark House, or
I wasn't clear. Our island home and Sherburne I was clear on, but I wasn't clear on. They said they were listing I think 20 proposed meetings, but the only two physical locations that I could pick out was our island home
and Sherburne.
Now,
Yeah,
I presume that they intended others, but I couldn't identify them.
yeah, or maybe not with maybe they're just focusing on those, but I think in this past year, when we looked, they did try to bring it on the road. So what they've done, and we know that there's difficulty getting clients out of the home, transportation, and bring it. Sounds like a great idea, but when you're that caregiver and you cannot get easily out of the home and whatever, so they decided they brought it to our island home. So they're providing this to the residents at our island home, plus anyone who's going to come in from a home setting. And the same with Sherburne, it's offered to the residents that are at Sherburne, but also anyone coming in. So the numbers, they've morphed from what was initial. Now it is providing a basically recreation program for a elderly population.
Well, and generally speaking, either a psychologically or mentally challenged population. So
Yes,
that is a subset of the elderly.
yes, exactly. Thank you, John, for making that clarification. So, you know, I think they, you know, I know the programs that they're running, you know, so they incorporate music, they try to do a seasonal type activity. And, you know, they've had some wonderful programs they've run, but again, you know, I think, you know, the $30,000 that they're asking, you know, for the amount of clients that they're seeing. Again, I think it's a valuable thing, but John, you make a good point of it. When we have the hierarchy of needs, this is a wonderful thing to do, but shelter and
It's a bit of, from our point of view, it's a bit of a luxury.
right, right. So, do we feel we want them to come in? I know we've had Brian and Jennifer in the past come in. Do we feel we need to have them come in, or do you think we have enough? Jericho's at hand up? Yeah.
Yes. I know that one of John's concerns was the actual activities, and they actually do a very good job. Like they have a newsletter where they share this stuff out. We can definitely request that from them, and they'll give you a solid array of what they're doing. If we're more concerned about the financial aspect of it, since they are basically Sherburne Commons is the fiscal agent for this grant, but the programming itself is largely delivered by community school staff. So that might be like, we might want to ask Brian to come in and run through that or something, but I'm sure we can get more of the actual activities if that's the primary concern.
Well, Jericho, let me ask you, if they appended to their application one or two of their newsletters, they would probably be almost absolute. If from what you do, the way you describe it, it would satisfy my interest, and I think the rest of our curiosity, without necessarily requiring them to come in and explain that part of it.
Then I'm happy to have us request.
Do you think that would work?
I mean, I think that would cover that particular angle. If we're more interested,
I think that's a terrific idea, because they would have had to put it in writing to attract the people they want to attract. That's going to inform us what they're trying to do.
then I'm happy to request that from them, and we'll have that ahead of any deliberations we do.
Okay. And of course, if they'd like to come in, they certainly are welcome to, but we won't be required.
Yeah.
Okay. Thank you, John. All right. Moving on to PASCON, and that was me. You know, once again, it's a very needed service on the island. They provide their service at no charge to the patient. So that's, you know, critical. Anyone needing palliative or end-of-life care, you know, it's provided at no charge. The problem I have here is the fundraising on page 154 just doesn't add up. And, you know, also the explanation of on 155 of the patients served, you know, I look at these numbers and I don't know if this is number of contacts. It can't be individual people served, because, you know, 700 people, I just, the numbers don't make sense to me. So I think we need to have them come in and give some explanation of that. But otherwise, you know, I do appreciate that, you know, they do education on what is understanding palliative care. They do an excellent survey, and that's, you know, how they are getting information, you know, so when you talk about a, you know, what's the effect? They've given us a copy of the survey that they give. So I do think we need to have them come in to give us a little bit of background. And, you know, here they also, they put, I guess they self-identified as healthcare. And I think that's, initially I questioned, I said, is this more elder care? But it really is healthcare, because palliative care can happen at any age. So it's not just a senior issue. So it is proper that it is under healthcare. Any other comments on PASCON from the committee? But, you know, like I said, the financial information that they gave it just did not add up. So if we can have them give more explanation on those issues and come in and speak with us. All right. Okay. Moving on to the next, we're going to skip NAMI because that is a capacity. And I'm also going to skip right now the AC ambassadors, because I'm going to move up to Martha's Vineyard Community Services. And, you know, I think this is one, we didn't have anyone assigned. I've read it, you know, and once again, this is the no-brainer. You know, they ask for very little money and they provide a tremendous amount of service. And you know, once again, I always look, they always hover around that $20,000, $19,000 mark. And, you know, we probably would, I know it's probably not appropriate, but I think if they asked for more, we probably would give them more, because they provide a vital service and they do it for so little. We can probably move on to, unless anyone has anything else to say about Martha's Vineyard. You know, here.
Well, I would just like to say that just for the benefit of a couple of our newer members, I have to say, I knew nothing about them before I served on this committee, but over the years, the amount of personal, what should I say, care that they deliver on a one person to a very specifically needy group of people, for the amount of money that we give them, is extraordinary.
Well said, John. All right. So let's move on to the next, which would be Lighthouse School. And Suzanne, that's you.
Okay, so I overall, there's a couple of confusing places here, but their program is the Educator Wellbeing Initiative, and they're requesting 100,000 in grant money. They have expanded that. They're building on a successful program from 2024 to 2025 that serves 74 educators, and they often had wait lists in the programs. They're hoping to expand that coming up for excuse me, fiscal year from July 2026 through June 2027. Each session they have, each year they have, let me find my notes here. They have programming that reaches all the educators on the island, not just the Lighthouse School. So they're reaching out to the public schools, Small Friends, the New School, no, not Small Friends, New School, and the Boys and Girls Clubs. And they break it down to a total population of 392 educators. But this is something that needs to be asked, because in their figures, that 392, they break it down to a number of educators at 160 teachers, and that and 292 is the overall number. So I'm not sure what that is. It doesn't add up right. We need to ask, are those teachers and the rest all administrators and staff at the schools? I wasn't clear about that. And who's being included in the target, program. And one other thing I had an issue with was the that their mission statement is the mission statement of serving the children at the Lighthouse School. It doesn't have a mission statement. I don't know if we need it, but it didn't have a mission statement for the program as it's named for the sure, and I just forgot the name of it. The Educator Wellbeing Initiative, and I'd like to see a mission statement for that. They do go into a lot of detail about the program, so that's really good. They have a really good list of their milestones and activities. The program description itself is, like I said, it's comprehensive. So that all is pretty clear. The budget summary, there was an issue with their let's see, they when they got down to they're clear about how much it costs for the programs, administrative fees and all that, but when we got down to, let's see, what page, where is that? They have a good follow-up program too, in assessing how people are benefiting from the programs, and they check in regularly with people. They do a January kind of an assessment, mid-progress evaluation. They'll do one in January of 2027. And they have a thorough breakdown for their milestones and timelines and activities, etc. The budgetary thing that was confusing to me, if I could find the right page here. All right, I'll just read from my notes and hopefully it'll make sense. Their operating budget just have in the previous fiscal year, I'm assuming they mean 2025 to 2026, was $131,970. And then they have the total expenses, $2,376,231. That seems to be the total expense for the whole school and not the program. And I think they need to be clearer about the breakdown between the school and the program, specifically for the WellCare for the education. I mean, for the educators. And then their net profit and loss was a little confusing to me as well. They really need to go over all of their figures as far as their they say that in the fiscal year 26, the grants received for fiscal year 26 was 15,000. And I put a question mark there. And then for fiscal year 25, it was 183,000. And for fiscal year 24, 121,580. I mean, 121,580. So why was it only 15,000 in for 26? I'm a little confused by that number.
I think what we're looking at is combination of the Lighthouse School overall budget and not the program. And this is something they have not done before. So, it's good to have, we see the stability or the instability of the organization overall, but the program that they're requesting for, they have not done before. And, one thing that this shows, like the Lighthouse School certainly runs a fabulous school. And this is the second time or so we've seen an application from them that they are looking not just for their staff, but they're looking to become basically the educator's educator. So reaching out and having all and they go all the way from preschool up, and I assume that includes administrators, so anyone involved with education from pre-K
Okay.
all the way to 12 at that 392 educators.
Yeah.
There was a program, and Jericho, how was that funded? That it was at the school, and I've heard wonderful things that took place. So it was a combination with MAST providing the practice, but groups of teachers, and fabulous result. But how was it funded? Because we didn't directly fund that.
In previous, Joanna, so there's been about 3 or 4 different of these wellness initiatives that have been funded in a couple of different ways. We did do initially, the very first funding we did for this was the Youth Behavioral Health Grant, which we actually did grant the wellness. I don't think that was a teacher wellness. I believe that was a returning student wellness program, but I can't exactly remember right now. Subsequent to that, actually alongside that, there was a rural health equity initiative that had a variety of grant funding. I thought specifically teacher wellness was something that was worth determining if it was going to take off here. And so I funded the teacher wellness through that source, which no longer exists, unfortunately.
Okay. All right, Joanna, I see your hand up.
Two things. I'm not sure why this needs to be under the Lighthouse School, right?
There-
And
Oh.
I'm not sure about that. And then the other thing is, oh my goodness, Elise Norton. She's the one who applied for the grants for this before. And I'm not sure why she's not doing that again and is coming this way.
So they have Stephanie Sarah as their grant writer now.
Yeah.
And the Lighthouse School seems to be the organizing portion for the whole island educators network. And so they're asking for money, not just for sorry, gotta plug my computer in, not just for the
Lighthouse School.
Lighthouse School, but it's for all educators. So that
Yeah.
Yep.
And and I know that they've obviously have it in their mission, because even when they bring in some excellent staff development people, and they offer it to everyone on the island, not just their teachers, but parents and the general public. Over the years, they usually hold them at the high school, in the auditorium or in their facility there, but I think they've seen it. It's a way that they keep their staff development, but they offer it for everyone. So I think it must be in their mission overall that they're viewing themselves as the staff development or education for well-being of all educators, not just their own. Because
I don't see me.
Linda?
They asked for 50 grand last year. It was one of the lowest scores on the rubrics. And we gave them, because we were confused and it wasn't fleshed out enough. And we didn't know the reach of the program. And I'm still skeptical, but they're doubling their ask from last year, and they got nothing last year.
Right.
So I'm just throwing that on the table for people that are new to us, because we were a little
Well, this
confused.
program, so I think there were 2 different programs, Linda. Last year they asked for something else. It wasn't this.
A speaker series, I believe.
Yes, speaker series, yes. Yeah.
This has happened in the last 2 or 3 years, because I was one of the instructors.
Right.
Right. So I'm confused as to why this is coming to us this way.
Yeah.
Well, I think we need to have them come in and, give us more background and what their intention. I'm not questioning what they want to do, because I think, Joanna, you probably know that for the teachers that participated in the previous, you know, it's again, a stress management, overall well-being, taking care of the people who are taking care of our children.
Correct.
So it's
And-
all, we're not questioning that. And then, you know, honestly, I'm going to go back to John and what he said before, that, you know, sometimes when we look at the hierarchy of things, you know, we have maybe more immediate needs in the basic level one. You know, it would be nice to, if we had much more money, but, you know, it's,
Well, Veronica, I was going to say something similar, because if you look at this from the perspective of the number of people who we need to give money to at the warming place, or the number of people at the memory care cafe, or the number of teachers who need daycare at Small Friends, right? Or the number of people who are going to take art classes at the Artist Association.
Right.
And this is the number of educators who are going, I mean, this is a lot of money for that program, right?
Versus rec services, which is what I think you're getting at, correct?
yes,
Yeah.
What
I'm-
was that word, Linda? What
Direct
services?
direct
Oh,
service. So-
direct. Yeah,
So
yeah, it
we've
is.
looked at treatment. Well, in the past, we've said treatment, direct services, or prevention. This is, you know, it could be that area. So prevention. So it's
So
a wonderful thing, but it's a lot of money, and I know it's not deliberations, and I shouldn't say, but with the amount that we have to give out, we'd be hard pressed to give them $100,000, because there's other dire needs above this.
Well,
But
those other programs ran on, I mean, when they've done it in the past to serve the people they were serving, those grants were like 30 grand.
right, exactly,
So I don't know what we're giving them that's going to cost $100,000.
right, right.
I
So
think-
let's have them come in and give us, you know, an explanation of a little bit more on what they're actually gonna do, and we know what they're gonna do, but also I'm not sure if they would get the numbers, you know, and it's nice, not every teacher is going to participate, so you know, we need more, so we'll have them come in.
Veronica, I'm focused, given what's going on in Washington and the state's trying to keep up. I'm more focused on human services,
So
Yeah.
not a teacher support thing. I'm more focused on the human services, and that's where my drive's gonna be when we allocate funding.
Yeah,
So we have a terminology in the grant request and in the grant agreements with level 1 and level 2 needs. Level 1 are things that are direct physical needs that are basically shelter, food, immediate relief from emergency financial issues, medical care, and travel related to a basic need. And then level 2, which would be a rung up Maslow's hierarchy, more or less. As to why the grant is coming in through the Lighthouse, the ASAP grant, I spoke with the principals involved with this while they were working out their grant, and I believe that ASAP didn't consider this to be on mission for the substance abuse prevention, and that's why they did not partner up with ASAP on this. And I don't believe MAST is a 501c.
It's
If
not.
they were a 501c, they could apply direct for this, but I don't
It's
think they
not.
are. Yeah.
they're not, yeah, okay. All right, well, let's have them come in and give us more detail, and you know, we will also, because of the amount of money they're asking for, we would want them to come in anyway. All right. All right, if we can move on, I'm aware of time here. So we have In the Herd, Suzanne.
Yeah, I really like this program. It was everything, the detail, they gave very specific program information around outreach, who they serve, their timeline, and there's been an increase in their population over time. They provided really good financials. Everything about this program I liked a lot. And I think that it serves a real important need, you know, working with people of all ages. It started out with a lot working with substance abuse issues and things, but it's gone on for more behavior, mental, emotional, in all age groups, children. And they have really good data to back up their, everything. I just like it a lot. Budget wise, sorry.
Yeah, I think what she's asking for, that's the overall, but what she's asking for is to continue for working with the Family Resource Center and bringing over our youth. I
Yes.
don't think that she's looking to expand beyond that at this point in time.
No, just they're reaching out to a broader age group than they used to.
Okay,
I think from what I read here. So let's see. Providing individualized solutions, mental wellness, substance abuse, and personal growth for groups of all ages and situations. They've increased it to it was ages 9 and up, and now they're targeting also 8 and up, which isn't a huge difference. But they've been in business or established since 2022. They're sure. I don't know why didn't have.
yeah, I think overall, within the herd and what she does on the Cape, she does work with the other populations, but I think for the Nantucket program, it is just basically 21, 22, and down to 8. This has been, and I'm gonna just jump in and add a little bit here, Suzanne, because we've had some history within the herd. We've never gotten unsolicited feedback like we've gotten on this program. The work that she's done with the kids that have gone over is incredible. It's taken a while to get the program going. She comes over with another staff member. She meets the youth on the Highline Ferry at 7:40. They get on the ferry. They do activities on the boat. She has a bus. They take them to the facility. She gives them snacks. She provides lunch. And it's a very structured program she does. And then at the end of the day, she goes back on the ferry and then delivers the clients back to the caregivers on the Nantucket side. It took a while to get the word out and the trust of parents. Initially, she invited parents and caregivers to go, and I think they came once and then they realized that she's trustworthy. She's running a tight ship and a valuable program. The validity of what she's doing is not questioned at all. Here once again, she's getting more participation, and I would love to see that we continue funding what she's doing. I don't know if we can, once again, $100,000 is a big ask, but we've had lots of discussion in the past, and I know Suzanne, you're new, and Lee, you're new into this, but it's an incredible program, and I'd like to see that we can do something to keep her going. She also is well aware she needs to be doing fundraising, that we can't be the only source of, and we've pointed her in some directions, and she has some things in the works. So to continue to be able to serve Nantucket. And also it would be wonderful if she could work with horses on the island, but her horses it's a very specific thing. They're all rescue horses, specially trained. It's not a riding program. This is, you're working one-on-one with a horse and building confidence and leadership skills and communication, etc. But that's enough of there. So anything else we want to add in at this point, Jericho?
And I want to add to that last point. I worked with Michelle for quite a while trying to see if we could get the program running in some way or another on the island. We investigated a variety of locations. We had people absolutely willing to participate. We just could not overcome some liability issues, and it, to my knowledge, it's very unlikely we could get this to work on Nantucket directly. So I just wanted to add that as something that she's really trying to be as integrated and connected to the island as she can be, and to try and do as much here. But this particular type of program, the way that it needs to operate, is extremely difficult to do here.
I personally went and participated with my grandkids just because I'm fascinated by what she's doing. And hands down, I have never personally experienced anything as moving as working with her horses and just her the whole operation she has. So anyway, do we want her to come and do, the money amount? I think, we probably would want her to ask. And, she's also relatively new into this whole grant writing thing. And she's really come a long way, and she's whatever. So we probably want her to come in and just give us a brief overview.
And maybe she can elucidate a little more on what she's talking about, engaging in conversations with multiple businesses to set up an on-island fundraiser next spring.
Exactly. Okay, good point. All righty. Next, we're going to go on to health imperatives. And I was surprised they did not apply for a capacity grant. So, Joanna, you just want to briefly, health imperatives. It's.
Yes. This was a
Okay.
lot.
Yeah.
And I don't understand why they have a different name now for this program, like Nantucket Health Equity Now versus Health Imperatives. And also, I have some similar comments. I don't see any, like, are there any board members in this organization that are from Nantucket? I also, the home visiting services for young parents, like that seems to be a potential duplication of services with the VNA, right? If we're going to be funding the VNA, I want to understand that. I mean, certainly this work is very important, and we have largely funded them to this level because they largely serve the immigrant population, which is really important here on Nantucket.
Yeah.
So they were extensive in all of their financial stuff. But the reality is that from what I can understand, essentially we're underwriting some piece of salary.
Yeah. And in fact, I was surprised they didn't just go for a capacity grant.
I mean, in my
it really is a capacity. This is a capacity.
In my opinion, they should have.
Yeah, this is a capacity grant. The home visiting services for young parents, I think, it may be a little bit of duplicate, but I think also I think they're looking a little bit broader because they do also administer the WIC program. So it goes beyond. I think that the visiting nurses, it is just postnatal that they're dealing with. I think they go beyond from what I'm either I have from talking with them or whatever. I'm not sure if the application necessarily said that.
The VNA does not do postnatal. It's health imperatives does the follow-up with the mothers after they get home.
So there's some overlap there. There's some home services that VNA has been providing under the HHS under an HHS grant from us, or HHS budget item actually. But yeah, this is delivered alongside the WIC program and with a greater degree of cultural and linguistic agility than typically VNA does. And I know that they've had an especially difficult time with the current grant situation, since they deliver sexual and reproductive health, which has been an explicit target of a lot of the grant issues. And my suspicion is that they didn't have time or didn't have time to fully understand the ramifications of operational versus programming, and so went with the safe bet because they are somewhat scrambling right now to ensure a variety of other funding sources. This is from the town side. This is one of the most comprehensive and professional organizations I have worked with here. They are constantly leading with these things. They're bringing programming to us, and then they're also taking programming that works here and deploying it elsewhere. They are very good to work with. I do think it would be a good idea this year to invite them to speak with us. I think both the size of the grant would support that, but I also think it would be very helpful and educational for everyone on the committee to see exactly what kind of challenges they're facing, and potentially outside of this, try and help them do additional fundraising. I know I'm trying actively to find additional funding sources that I can use to support what they do on Nantucket, because from the pandemic on, they've been right there doing it and been very, very effective at doing so. And I would really like to continue that pattern that they're doing.
Exactly, yeah. Julia Kehoe attended our grant award ceremony back in September, and a brief conversation I had with her, she did share a lot of the challenges because of, being involved in reproductive health and just what they do and the challenges that they are having. And she assured me that services wouldn't be cut back on the island, but they do have major gaps that are forming in the whole organization. But a point, it would be nice if we could get a Nantucket representation on their board, because as we know, their WIC program or whatever, they've had extraordinary success on Nantucket, and Nantucket is used as a model nationwide, not model with the work that they've done. So we are maybe the little pimple on the elephant, but we do have an impact outside, and their service delivery, et cetera, is bar none excellent. So, but I think yes.
Oh, sorry. I have a question about their, is there an overlap with, they talk about the, sexual abuse or different things. Is there any overlap with programs with Safe Place for what they can provide for education or anything? No.
No,
Not
Erica's
particularly.
shaking said no.
no.
In general, they refer out to that, but they don't focus on abuse. They tend to do
Medical.
more of the health checkup and that sort of thing.
Okay.
Yeah.
I know they actually work together. I believe they work together with the Safe Place quite closely, but
yeah.
I don't think they do exactly the same kind of service.
Yeah. There's collaboration with a number of organizations.
Family planning back in the day.
Yeah.
Yeah.
Oh, right. Family planning. Yeah.
That's
Yeah,
what
they basically are the Planned Parenthood on the island without being
Okay.
called Planned Parenthood.
Okay.
Okay, we can go on to the next, which would be Elder Services nutrition program. John?
Okay, well, as always, it's an extremely well put together
Right.
proposal. It's really pretty hard to find fault with it. They do, in fact, although they serve all of Southeast Massachusetts, Robert Kucharby is the Nantucket representative, and I know him from my work with him at the NHA. So he's clearly an effective person for that purpose. I really think the request is for $35,000. It is very clear where that money goes. We don't have any. they've been an applicant for years, and they spend it as efficiently as they can. It is the service that they provide in Meals on Wheels is, there's nothing that duplicates that or approaches that. Servicing elder people in their own homes and people who often can't get out of their homes. And of course, they have in order, that delivery is all volunteer people, so that it's not, they reach out to the community. Sherry Hunt is, well, all of us who've been around know Sherry, and she's one of those irreplaceable people. But so I think
I think this is one of the organizations that, you know, their ask is not very large. It's always within that range. Their service cost is going up. So I think it's a little bit more than we've done in the past, but we don't question what they do, because they do it extremely well and it's extremely necessary.
Just but partly this for the benefit of our couple of our newer members, the congregate meals are. I had never really gone to many of them, but it is a very interesting working with our elder services group, and it provides a socialization for the people who can get out of their houses, and they make use of the town supported facility, the Elder Services Center. And I do know that from talking with Sherry that I'm trying to think of his name, but the provider of their meals used to be the hospital, and then
Yeah,
the
John
hospital
King.
walked away from them, and John was
Yeah,
the
I think Kitty's,
Kitty's,
you know,
is it Janine? I don't know, I can't remember. Anyway,
John
Kitty's, and Kitty's does I know from having eaten at Kitty's, they
Right.
do a very good job of providing the
Right.
food, and they clearly they aren't in this for the, I mean, they need to cover their costs, but they aren't in there to
it's
make
not a profit center for them, and
Right.
they're providing service for the community, and it's,
right.
And
Anyway,
their price.
there's really not much more one can say.
yeah. Linda?
Their cost per meal has gone up over the last 3 or 4 years since COVID.
Oh, yeah.
And so Sherry never asked for more than they need, but we always tell her to ask for more, but she
Right.
never does.
Right. Jericho, did you have something?
Yeah, and just to add, this is one of our none of them are completely no-brainer proposals, but this
Right.
is as close to that as it gets.
Mhm.
These are medically prepared under the supervision of a nutritionist. They're delivered. They're tasty. The congregate lunch program itself at the Saltmarsh Center is like that. I've been there enough that I see them. It's a solid group of people, and it's serving a real important need for them. It's a level 1 need as identified in our hierarchy of needs. It's a really good program, and they're dealing with, I think, by some measures, food costs and an associated price have gone up about 30% over the last 4 years. So it's remarkable that the ask has not gone up as high as that.
Okay, I think we can put this one to bed. We certainly don't require her to come. We won't eliminate, but she's a busy person, and I think we can move on from this. Artist Association, thank you, John, but Artist Association, Linda?
Interesting program. We started out with them, I think, in 2015, when Dorothy and I went out there and watched it and spent quite a while out there talking about this program. They've come back almost every year. FY21, it was 18,200. 23 was 23,200 they got. FY24 was 20,000. We just had a lot of asks that year. I'm not sure we funded them last year because in FY 26, I had them asking for 50 grand and I didn't see them on the actual getting any funding from us.
We funded them
They-
last year.
Yes,
Remember,
yeah, they
don't-
did.
Draft.
Yeah.
No, I thought we funded them, but I couldn't find it on my stuff from last year.
I think we
That's
gave them
weird.
40. I think we gave them 40 last year.
40, yeah, they asked for 50 last year, they're asking for 60 this year. It's wellness through the arts, it's been wildly successful. Let me go back to my page here, been wildly successful. Especially, you know, with people who are still PTSD from the pandemic. There are people that are going, from substance abuse that need to focus on something other than their issues, and it's provided a great socialization, refocusing their minds on something that's creative. They're collaborating with a lot of other groups, reaching out to other groups, because during those years when they were first coming in here, they said, are you talking to the Boys and Girls Club? Are you talking to the Saltmarsh Center? This particular project, they've lost two of their grant funders this year. Because it was us and two others, and those two have ceased to exist for them. And what they'd like to do is take this 60 and expand the senior program, which has also become very popular. So most of the funding for this year for the 60 grand is to increase the services to the senior art series. Without funding from us or reduced funding from us, they'll have to scale back the whole program. But they expect to serve approximately 150 to 175 students throughout the year, FY 27, because these programs are year round and they serve from age 3 to 90 plus. So I think they've got a pretty good handle on it. They were sort of learning as they went along those first 5 or 6 years. And then COVID threw them into a tizzy. But they're trying to improve the participation for depression and anxiety and self-esteem and et cetera. But particularly this one is to improve the reach out and provide the services for the senior art series. So that's pretty much where we are. They always seem to be the one that gets cut when they come in. Any particular portion of what they're asking, but they're back with 60 grand as opposed to 50 last year. But I think the biggest impact on this whole program is that they've lost the other two funding sources.
Exactly. And I think also over the years, just for some history, they had started out calling it a different name and a different, it was a formula. It was a specific program, and they were not necessarily providing that level of service with a therapeutic rec person, et cetera. So they took some direction from us, and I know Jericho, you were instrumental in having their staff trained in mental health first aid, QPR training for identifying individuals at need, at risk. So they have embraced anything that we have made a suggestion with. So Jericho?
When they initially launched, it was a clinical program.
Clinical, that's the word I was looking for, yeah.
They didn't have the
specific-
training.
Yeah, well, I mean, they had a licensed clinician who was doing it, who, like, I don't remember exactly, but we're talking about like a like almost nurse practitioner level. And that was due to an extremely lucky set of events. There's basically no way they could keep that standard up going forward. But we did get them, yeah, it was QPR, it was mental health first aid, and I believe we also got some trauma-informed care classes in there.
Yes.
And they substantially altered kind of how they approach it. And then we also managed to see, I think that they've managed to increase the number of students, I guess is the proper term, increase the number of students because there were issues around waitlisting or just not having sufficient volume to address the issue. And I know that they've increased the amount of people that they see, and they've managed to really kind of get much more not clinical adjacent stuff going on there. It is a very good program that I like to see.
Suzanne?
Yeah, I'll give you a personal quick review. When my nephew was dealing with colon cancer and my sister came back to the island to be with her son as much as possible, the stress on her knowing her son he was in 4th stage and it was really bad. If she didn't go to those classes, I think she would have lost her mind. She had it, artistic she liked to paint and draw and everything, but it made such a difference for her to get out and stop focusing just on her son's health and to do something for herself. I couldn't say strongly enough how much it helped her. And sometimes I had to drive her there just to get her to go. But yeah, it was wonderful.
Yeah. Okay.
Healing through the is very well established. Like the horse thing, I used to deal with that horse therapy, but healing through the arts is very well established.
Huge.
Very important outlet for people that are under stress.
Yeah. All right. We will invite them. Do we have any specific questions for them at this point?
Do we need to invite them?
Do we need to? If they'd like to come in, I guess, because I think that the application is pretty complete. Okay, so I'm aware of time. It's 11, but let's get through Safe Place. And that's Lee, if we can do that. And then we can see if we want to extend or go from here.
Yeah. I'll be brief. I know we're running out of time, but this was a very good application. Again, not having the track record that you all have. I was impressed with the level of detail. I was disappointed at the tremendous need for it, obviously, but the organization is well put together. It's well funded. I was impressed at how well connected they are to other key governmental agencies, including the police, the hospital, and the court system. They're seeking $75,000. Their description seems a bit generic, but certainly I would understand that there's need for support, and education might just be that, meaning generic. It would appear that the need for this has increased over the past year. Not a great stat to hear, but they did give that level of detail in their application as to the number of people that there's a need for their service. I reviewed their website and the memorandum of agreement, and also their financials. Again, I just think it's a very solid application. This particular application, as a few of you have noted before, did make note that they expect funding cuts by the Massachusetts Office of Victim Assistance, as well as a few other agencies, which I think we kind of anticipated. So, that's unfortunate on their end, but otherwise they seem pretty well funded. I did add some questions on the financials. Let me just take a look. The anticipated program budget, it seemed to be a disconnect between their operating budget. I'm not sure if I'm just not reading it correctly on that, but I am sure they could explain that in short order. It would appear that the last grant that CRC gave was $60,000, so this doesn't seem out of line. And honestly, I'll just end with it would appear, given the work that they do, really good work, that it would be a high priority. I think the gravity of the need for their services is pretty significant.
I think you summed it up really well, Lee. The one thing that I found is the profit loss statement was not attached on mine.
Yeah, I asked Alexandra yesterday for the financials, because that was not part of it, nor was the MOU with the hospital, you know, which I just wanted to take a look at, but I do have the financials if and Lexi can circulate.
Yep. Lexi, if you can share that with all of us, because that was a question that I had. It says following and it just wasn't there, so you know, we funded the last year, I think it was the Beacon packet, you know, and they've now, you know, fully done that. We also funded last year the Source Hub, and you know, they've recognized, you know, now they're working with the Brazilian Resource Center because they recognize that an outreach into the Brazilian community is important. So I have hands down, and I know Linda, you have a lot of you've had contact with them over the years, and just the organization is just fabulous and what they provide. So
Well, I was one of the founding members, so
Yep.
like, it was a safe house and all the rest of that stuff, so I have
As
the
was
utmost-
I.
utmost confidence in that group completely.
yeah.
Just a note, I mean, I happen to know from having been a user of the facility into which they moved, the fact that they have found a really appropriate permanent home is an from a point of view of Nantucket, a wonderful development in this for this organization, and
Yeah.
I've been able to organize that and get it done, and knowing what that facility is, I mean, I've been in it enough so that, and I've heard about how they redeveloped it. We have a confidence that they're not at the end, you know, trembling at the brink of losing their house.
Exactly.
Mm.
Exactly.
Good point.
Yeah. Okay, we now, I was going on, we've got NCTV, we also have the New Hope group. And I skipped over those before. It is 11:09. I know, Linda, you have to leave. Next week, we have the capacity grants. I'm gonna suggest that we take New Hope and NCTV and move it to next week. If that's fine with the group, because, you know, we're over 2 hours now, and I'm trying to respect people's time also. So if that's fine with everyone, can we move,
Yes.
we'll do that, so.
Sounds good.
We'll adjust the agenda for next week to just include the rest of the grants along. Basically, we can just adjust it to say the rest of the grants plus the operational grants that we'll discuss next week at 9 AM. And we have next week, and actually that'll be the 7th, the 14th, and the 21st. So we have meetings for the next 3 Fridays. And hopefully at the end of the 21st, we have finished deliberations. If we need, we do have another date on schedule in December. But thank you all for your efforts. You know, it's a lot of reading we've done in this past week and past 2 weeks, but fascinating. We've got some incredible organizations on the island serving our population, and it's an honor to be able to help serve them this way. So with any other new business to be said, could I have a motion to adjourn?
Motion
So
to
moved.
adjourn.
Okay, so
Second.
all right, second. So by roll call, we have Linda,
Aye.
Lee,
Right.
Suzanne,
Aye.
Joanna,
Aye.
John,
Aye.
myself. So we are adjourned. Happy Halloween, and we will see everyone next week. And Tara, thank you for being here today. And Jericho, safe travels to you. And Alexandra, happy Halloween. Get some of that candy, I'm sure, is in the office now. All righty. Be well, everyone.
care.
We'll see
All
you
right.
next
Take
week.
care.
All right.
Bye.
Thank you.
So funny, people call you Alexandra.